Hello everyone, welcome to my channel. Today we'll be looking into vitamin D deficiency. You may have seen some headlines such as vitamin D prevents heart disease, it fights cancer, it stops dementia, but oftentimes it's not that trivial. We as humans, we struggle a lot with statistics in general due to many reasons that I will not discuss right now, but here's something that I want you to keep in mind, that whenever medical research or any research in general is being discussed, it's best to stay at least skeptical about the conclusions. We will cover cardiovascular health, mental health, muscle function, and mortality. Along the way, we'll also learn why association doesn't equal causation, which is crucial for understanding health research and research in general. We'll also discuss why the supplementation of vitamin D sometimes works and sometimes doesn't work. Let's start with the big picture. Overall mortality risk. This 2019 systematic review of observational studies found inverse associations between vitamin D levels and all-cause mortality. What's interesting is that the association was non-linear, which means that as the vitamin D levels increased, the mortality decreased up to a certain point, and beyond that point there was no further decrease. So you may ask yourself, this sounds impressive, right? If people with higher vitamin D live longer, then taking vitamin D as supplements will make you also live longer. But actually, it turns out that this is not the case, at least not always. CBD gives us the clearest example of why you cannot just assume correlation equals causation. In this research, they looked at the relationship between low vitamin D and ischemic stroke risk. The research found that the lower vitamin D levels were associated with increased stroke risk. In another meta-analysis, looked at the 25 prospective cohort studies with over 10,000 cases of CVD. They found that lower vitamin D were associated with higher relative risk of CVD, a relative risk of 1.44, which basically means that the risk was 44% higher for people with lower vitamin D levels. So based on this data, you may think, great, I'll just take vitamin D supplements and reduce my heart disease risk. Well, it's more complicated than that. When researchers actually test whether giving people vitamin D supplements prevents CVD, the results tell a completely different story. One meta-analysis examined 21 randomized clinical trials with over 83,000 individuals. They found that vitamin D supplementation was not associated with reduced major adverse cardiovascular events, myocardial infarction, stroke, CVD mortality, or all-cause mortality. Another meta-analysis of 18 trials with over 70,000 participants. This analysis showed no effect for protecting against stroke. So let's stop for a moment and think about what we have looked at so far. So we saw that some studies, they show that people with lower vitamin D have like 44% higher risk of CVD, but on the other side, people who were taking supplements with vitamin D, it did not prevent them from getting CVD, right? So like, what's going on? Well, there may be several possible explanations. Maybe low vitamin D is a marker of poor health rather than a cause. Maybe people who spend more time outdoors exercising have both higher vitamin D and better cardiovascular health. Maybe it's the exercise that really matters and not vitamin D. Or maybe people who are already sick, they just spend more time indoors. That's why they have lower vitamin D. Or maybe there's like a different reason for it that we cannot even think about. So as we discussed, there's a difference between association and causation, right? We know that people with lower vitamin D, they have more CVD, but at the same time, giving people vitamin D doesn't necessarily prevent it, at least not as much as we could think that it will do, right? So does it mean that it's pointless to take vitamin D? Well, it's not. There are many cases where it's scientifically proven that taking vitamin D has real effects. What I wanted to show is that you shouldn't conclude that just based on some research where it shows a correlation that there is also a causation. So just because there's this association between people having low vitamin D levels and them having a greater risk of having some certain type of diseases, it doesn't mean that there's also causation, that it's the low vitamin D that caused this or that, right? So it also doesn't necessarily mean that taking vitamin D will prevent people from having this disease. So keep in mind that association is not causation. Okay, now let's take a look at mental health, and it also shows a similar pattern to CVDs, where we have a lot of associations, but there's a weaker intervention evidence. Here we have a meta-analysis where participants with vitamin D deficiency had increased risk of sleep disorders compared to those with adequate levels. Here for depression, one review showed that there is an association between vitamin D and depression. They also concluded that the evidence is not strong enough to recommend universal supplementation in depression. Here we have another review that showed that there is an association between vitamin D and depression. And here we have some evidence that vitamin D supplementation may help people who are already depressed. Next we have sarcopenia, which is an age-related loss of muscle mass and strength. Here we see another example where observational data doesn't translate to intervention success. This review found that low vitamin D levels were associated with decreased muscle strength, reduced physical performance. So that sounds like vitamin D supplementation might actually help you, right? And as we discussed before, it's not necessarily the logical consequence. Here we have another meta-analysis of 35 studies with more than 6,000 participants that found that vitamin D supplementation showed no effect. This 2022 systematic review examined vitamin D monotherapy on sarcopenia, and it found that the vitamin D supplementation did not improve any sarcopenia indexes. Here we have another trial where they checked whether giving people vitamin D will help them with sarcopenia, but it did not. So we all may think at this point that no, vitamin D supplementation will not help you with sarcopenia, but this review shows that there's an important nuance, and it's exercise. So vitamin D supplementation appears to be most effective for increasing muscle strength in people with lower vitamin D, which is below 30 nanomoles per liter. So vitamin D supplementation works best when combined with exercise rather than as a standalone intervention. And benefits are mainly seen in people who are truly deficient to begin with. If you are already healthy and not deficient, the vitamin D supplementation probably will not help your muscles. Okay, so what's the takeaway from all this? First, vitamin D is not a magic cure. As we discussed today, it primarily helps the most when correcting actual deficiency. Second, I would advise you to have a little dose of skepticism when you are reading some news headlines especially about medical research. Then it's best to go and not only read the headline, but also read the whole article, then go to the research and then see exactly what was the conclusion that they took from it. And last but not least, remember that vitamin D supplementation really works and is scientifically proven that it does help you, but not in all of the cases. Just because we know that having a lower vitamin D levels is associated with some diseases, it doesn't necessarily mean that getting those levels up to a certain level will help you or prevent you from getting those diseases. And that would be it. Thank you very much. If you have any questions, please let me know in the comments. Hit that subscribe button and also the like button.